Assalamu alaikum wa rahmatullahi wa barakatuh. Today's video is very important not only for patients of diabetic foot but also for diabetes patients and for other doctors and medical personnel. Because today we'll discuss 100 most important facts about the diabetic foot, and believe me, many of them are well not known to most of us. First of all, that about 10 to 15% of diabetic patients will develop diabetic foot at some stage of their life. Diabetic foot cases are 50% of all diabetic patient admissions in hospitals. By medical education and good supervision, many amputations can be avoided. Three factors can combine to cause tissue necrosis, infection, ischemia, and neuropathy. Vascular and neuropathic diabetic foots can be distinguished. Most of the ulcers or gangrenes start from a very trivial wound. In ischemia, the pulses will be weak or absent and feet cold, but in neuropathy, feet will be warm with pulses present. Diabetic foot ulcers usually occur at the sole of the feet but can occur at shins, gluteal region, hip region, etc. Peripheral neuropathy due to lumbar root damage or pressure can be a cause to aggravate. Smoking, long duration of diabetes, poor glycemic control, and previous foot ulcers are a risk factor for further diabetic foot complications. Signs and symptoms of a possible ulcer include swelling, redness, hard skin, dryness, pain in foot, and warmth. These are the indicators of a possible future foot ulcer. Check numbness in the distal toes and foot dorsum area. Ask for paresthesias, etc. The pulses which should be checked at examination are: number 1, dorsalis pedis artery, that is at the dorsum of the foot. Number 2, popliteal artery. Number 3, posterior tibial artery. Wound care, cleaning, and dressing are essential for a diabetic ulcer. Men are at high risk for diabetic foot ulcers and other complications as well. Blackening of the wound. Blackening of the wound or ulcer area is a most serious sign and immediate consultation of a surgeon to be achieved. Diabetes of a long duration causes skin to be thinner and more vulnerable to wounds. Special care is to be taken. If wound healing takes a long time, the infection may occur spreading to bones and joints. Patients should be taught to watch the hyperkeratosis, fungal infections, skin lesions, skin dryness, and foot deformities. Superficial ulcers just involve the skin and subcutaneous tissue, whereas deep ulcers involve muscles, tendons, and even bones. Diabetic ulcers can lead to many complications, for example, cellulitis, gangrene, sepsis, abscess, osteomyelitis, lymphangitis, limb ischemia, and unfortunately, amputation. Foot x-rays are needed to monitor the progress. And for ischemia, Doppler ultrasound and femoral angiography is used to judge any blockage. Foot warts should be consulted by a dermatologist. Careless removal should be done by a specialist so that it does not cause an ulcer. Early advice should be taken for any diabetic foot complication or diabetic foot ulcer to avoid further progress. A podiatrist should be consulted as soon as possible once a problem starts. For a complicated case, involve the wound care specialist, podiatrist, diabetologist, dermatologist, and a surgeon. Patients should learn the principles of foot care to prevent ulcers and gangrene, etc. Once gangrene has set in, the aim should be to preserve the viable tissue. Fungal infections between the toes should be kept in mind. If a diabetic foot if a diabetic foot develops a bony deformity, it is called a charcot foot. Physical activity should be encouraged to improve overall circulation and health. Proper nutrition, full of protein diet boosts immune function and wound healing. So protein diet it boosts immune function as well as wound healing. Bunions and hammer toes can increase ulcer risk. Dry, cracked skin, especially of the foot area, can lead to ulcer. Drink plenty of water as hydration is important for skin and overall health. Remove hazards at home, office, and other places where a person works, as sharp edges of table, chair, or bed, etc., can cause a wound at shins. Shins are slow healing in diabetics as the blood supply here is very poor. So, after the foot, if another area for which most care should be taken is shin in front of the that is the portion in front of the leg. Once a patient has diabetic foot or wound or ulcer, sports activity will need to be stopped. But of course, there is variation from person to person and case to case. For diabetic foot patients, heavy sports and running should be avoided to avoid the minor injuries. Foot temperature monitoring detects the early signs of inflammation. Treatment plan for each patient is customized according to the individual demands and requirements. Regular weight checks are important as weight reduction helps the pressure on the feet and ulcer area. A foot ulcer heals much slowly in diabetic patients as compared to normal people. The diabetic foot wound or ulcer should be avoided from water or exposure to water, for example, during washing or bathing. When a person takes a bath, the area of foot ulcer must be covered by a dressing, etc., to avoid contact with water. After diabetic toe amputation, driving with automatic car is permissible and possible, but manual car driving, especially with left big toe amputation, will increase the risk to the metatarsal head area to develop foot ulcers. Now we come to another important, rather most important aspect of the treatment plan, that is the control of diabetes. Good diabetic control is a must for diabetic foot patients. A sugar level of HbA1c less than 6 is highly recommended for diabetic foot patients, and random sugar less than 110 gram per deciliter. As is well known that during infection, diabetics on oral hypoglycemics may need insulin. In fact, most need insulin. And those patients of diabetic foot who are already using insulin may need to increase the insulin by 25%. HbA1c should be routinely monitored along with blood pressure and cholesterol. Compliance with diabetic medicines is important, and ulcer needs to be reassessed by the diabetologists. General principles of food avoidance to be followed. For example, fruits like mango, dates, grapes are to be avoided for diabetic patients, but grapefruits and strawberries, even guava, are good. Now, the important thing is that apart from diabetic control, blood pressure control is also important for foot health. Now we come to some other measures which are important and ancillary to the treatment of diabetic foot and other diabetic foot complications. Obesity must be controlled as obesity puts more weight on foot soles and foot ulcer area. As advanced therapy, growth factors and stem cell therapy are being researched for the treatment of diabetic foot ulcers. For established cases of foot ulcer, foot elevation improves the circulation and reduces swelling. Good sleep helps overall health and healing. After foot surgery, a walker or stick is helpful to decrease the weight and pressure on the feet. In some patients, angioplasty may be needed to improve the circulation. Now we come to the role of antibiotics. Infection can develop very rapidly in a diabetic foot. Therefore, early antibiotics are advisable. Antibiotics should be based on cultures. Organism grown from the surface could be different than the one in the deep wound. Fusidin ointment or cream is good as local antibacterial agent, but Mebo is a good healing agent for ulcers. Most diabetic foot infections need systemic antibiotics based on severity. So they will need systemic antibiotics. For more severe or moderately severe infections, a two or even three drug combination is given to cover a wide area. From my own personal experience as a doctor, I treated a small wound ulcer at the shin with Mebo cream along with at times use of Fusidin, and ulcer was healed in 14 days. Now, another thing that vitamin deficiencies, for example, vitamin D, can impair healing. Now, some other treatment methods that in some cases hyperbaric oxygen therapy is used to enhance the healing, and also negative pressure wound therapy can promote healing by removing the exudate. For wound healing, vitamin C to be regularly taken in the days of illness. Take vitamin B as an ancillary vitamin for diabetic drugs as it is good for peripheral neuropathy. Pus collection. Pus collection should be drained, and if bone is infected, excision done if osteomyelitis develops and does not respond to medicines. For wounds, dressings should be used to absorb the exudate. Dead tissue at the ulcer area should be removed by debridement. For treating the large ulcers, skin grafts may be needed. Bioengineered tissue can also help in healing. Due to peripheral neuropathy and numbness, foot surgeries are well tolerated without general anesthesia. Now, some general instructions about the foot and the shoes. The ulcer site must be kept non weight bearing, and after healing, the affected area should not be weight bearing to avoid recurrence. To avoid the affected area, special shoes and insoles must be used. Before putting feet in the shoes, check shoes inside and outside for any sharp object. Cases have happened that because of peripheral neuropathy, a patient did not feel anything and there was some sharp object in the shoe which caused the damage and the wound. Shoes should not be tight but loose at the toes. Insoles should be customized and made from a good reputation shop. Shoes with laces and thick soles are better to avoid the injuries and sharp objects while walking. Open sandals not recommended for outside use because of the risk of injuries. Now, a few words about the uh, toenails. That the ingrowing toenail can be a source of infection. Proper trimming of nails to prevent injury is a must. Hand nails should also be trimmed as nails can cause a small wound in the feet. Nail abnormalities and discolorations apart from ingrowing toenail should also be noted. A very important point that the moisturizing creams must be used even for those patients who do not have diabetic foot complications but they have diabetes to avoid the dryness at the foot, especially at the sole. But they should not be used in between the toes to avoid the fungal infections. The feet must be inspected daily. To avoid the infections, pneumococcal vaccine and influenza vaccine is highly recommended for diabetic patients. Social help is necessary for psychiatric support at various levels because amputation is a big trauma. Community and family support is also needed to motivate for diabetic control, compliance with the diabetic medicines, and avoid the foods with high glycemic index. So these are exact 100 most important facts or points for the care, management, and avoidance of the diabetic foot ulcers and other complications.